If you are struggling with chronic nasal issues, with trouble breathing through your nose, with chronic mucus, post-nasal drip, with chronic sinus infection, very important part of an evaluation is something what's called nasal endoscopy. Nasal endoscopy is a very quick procedure that only takes 2-3 minutes in my office, but it's going to help us to identify the root cause of your problem. If you suffer with nasal or sinus issues, please make an appointment so we can perform the endoscopy for you. What to expect? When you arrive in my office, we will obviously first talk and see you. You will tell me what chronic issues you've been facing for many years, what treatment you have done. And many patients have extensive treatments. They've tried different allergy sprays, they've tried saline irrigation, they tried many allergy medications. Some patients have tried multiple antibiotics, oral steroids. You might have even been on allergy shots or allergy drops. But if you're still suffering with issues, then nasal endoscopy will let us know why you're still suffering. When you come to my office, when we are ready to do the procedure, I will have you comfortably sitting in my exam chair. And I have it set up so that you and me both can see what's happening inside of the nose. I know sometimes patients are very scared and think it's going to be a very painful procedure, but don't be worried. I use flexible tip camera to really let me maneuver throughout the structures in your nose so you don't feel any pain. As a matter of fact, most patients, I don't even have to be numb for this procedure unless you are very swollen, and then I would not be able to see anything. But we'll first look together. So while you are sitting in the exam chair and we have our screen is facing both you and me, I will place this very thin camera tip in your nose and we'll start seeing some of the structure in your nose. Again, if medications are not working for you, there must be a reason and we will identify it together. We will look at, do you have, for example, a deviated septum, the wall in the middle of the nose that's not straight? Do you have very swollen structures called turbinates that are lying on the bottom of the nose? Do you have thick mucus that's colored, indicating some chronic infections? Some patients can have polyps, which is basically skin in the nose that's so inflamed it keeps on growing and filling your nose. Some patients can have tumors as well, especially patients that have, let's say, chronic bleeding. So all these things can be identified in a matter of minutes without you experiencing any pain. If you want to get better, please make an appointment.